Good afternoon, all you IH804 mobile health aficionados. Welcome to all of you who are cruising the YouTube looking for something interesting to listen to about mobile technologies. We're here to help. Actually, I'm here this afternoon with John Payne and Mary McNabb. I'm James Wolfe, and we are co-facilitators of a course at Boston University, which, if you're taking that course, you will know about, on mobile technologies and how they can improve health outcomes. And we're going to talk for the next 15 minutes about the evidence for mHealth and look at the state of the evidence for mobile health improving health outcomes. So I have a number of questions that I'm going to pose to John and Marion. And the first one is, in what areas has mHealth impacted health outcomes, and where do you think the field is going over the next couple of years? Marion, you want to start off?
Sure. It's a very interesting question. And I would say over the last 7 years, there's been a real push to actually do some rigorous research on whether mobile technology does in fact have an impact on health outcomes. There was a pretty seminal trial that was conducted by Lester et al. In Kenya that showed the use of mobile technology and SMS messaging and interaction with HIV/AIDS patients does in fact have an impact on adherence and therefore clinical outcomes, increased viral load. So since that study done a number of years ago, there's several groups that have been established. One is the mTERG, or the Technical Evidence Review Group for Mobile Health with WHO, and they are sort of responsible for helping to identify all the evidence in the field and develop frameworks for how different mHealth interventions can be evaluated. There's also a couple of really good meta-analyses by Free et al. That look at the impact of mobile tools for behavior change communication, as well as provider job aids and support tools. But now I would see what we're seeing now a lot in the field is a real push to do cost-effectiveness studies to see how much it costs to actually implement an mHealth program and what is its impact on lives saved.
Great. Well, John, do you have anything you want to add to Marion's very useful comments?
Yeah, just a couple ideas. One is that mHealth is still a very new field, so the evidence base is small but growing. And there's some reasons for that, and the biggest one is that we just kind of intuit that mobile tools are going to support a lot of activities that are being performed in the health system, especially around data collection or data use, and also around any type of job aid that's being used at the point of care, because a mobile device can provide that kind of support much more easily than, say, a computer. One of my mentors in the e-health space, Hamish Fraser, who is a leading researcher in the use of electronic health records in the developing world. His approach to research I found very interesting. I think is also relevant to mobile health, which is that the first question you ask is, can you even use tools in this environment? And second would be, what does it look like when you start to do that? So that's, we started seeing papers that are just describing projects. A lot of publications of mHealth are just doing that. And then you start asking more advanced questions, which is, are they contributing to the indicators or outcomes that you have of interest? And then you're seeing if you can actually do that impact at a population level. So mHealth is certainly still climbing that ladder, and we're not there yet. And I think I'll stop there.
Well, yeah, I might just comment on your comment, and that is, I think that it's meta comment. Yes, it's very difficult actually to tease out the mHealth tool from the program, because if you're looking at program impact, you're measuring both the program itself and also the program with the tool, and separating those two things out is somewhat difficult. I kind of also agree with your comment that the mHealth is just a tool. It is, and it's inevitable that we're going to use them because technology is, we have, you know, as long as time has gone on, integrated technology into our work processes and workflows. And so it's coming, and I think some of the questions that we really want to ask are how do you do it right? And are there ways that it works and ways that it doesn't? But we'll get there maybe in the next 10 minutes. So let me ask you a second question, which is what are some good examples of mHealth program evaluations that you've both participated in? And can you talk a little bit about the lessons that you have learned from doing these program evaluations? John, we'll start with you.
One of the things that we learned early on is that patients and health workers tend to like it when there is a mobile phone involved in the clinical experience. And so follow-up studies have started to take place to say, you know, what does that actually mean? What are their perceptions? How are those perceptions changing? An evaluation with Dan Palazuelos in Mexico, where mobile devices were being used by health workers to help them manage the prescription regimen for clients and to select the right dosage. And the perception of the health workers was that it improved their decision-making capacity. It made it quicker because they got rid of their paper pamphlets that they were using for dosage calculations previously. And it also made them look like a more empowered health worker because the tool, having a mobile phone in your hands, patients perceived you as having more authority in what you were saying. And another study that Brian Dorenzi was the researcher, and were use of SMS in Tanzania for follow-up with HIV clients that needed to be seen once a month by community health workers. And it was found that when you add an SMS in to remind a health worker to do follow-up, that the timeliness of those visits improved significantly. And a further study found that if you escalated that to a supervisor, if it was a visit was very late, that you improved compliance or timeliness even more.
Excellent. Marion, your experience?
Yeah, thank you. We have several, I've had the fortunate opportunity of several research studies with some of our projects in Pathfinder, and one of the most interesting ones is a study that we did on our MSANAS project in Mozambique, which is a SMS intervention for young people, targeting them with family planning information as well as narrative stories. And so the young people received narrative stories about a person's experience, trying to basically enroll on a family planning contraceptive method. And so after that, they received the stories. They also received information about different family planning methods. So we conducted with our E2A project an evaluation that interviewed young people at baseline and endline, and found that in fact it did improve the knowledge of young people on family planning methods and their intentions to use contraception, which was fantastic. But back to Wolfie's earlier point, this project wasn't done just as an SMS standalone project. It was integrated within a larger health service delivery program. One of the main lessons that we learned in that evaluation is, can you use SMS itself as a tool to ask questions to the young people as part of the research? And what is the drop-off rate of how often you would answer a question correct, pinging back and forth. And now, I think researchers are trying to understand how do you use, could you reach large numbers of people to ask survey questions by SMS, and what's that response rate? Right now it's about 35%.
Great.
So quite interesting. And one other lesson we learned is that when we tried to contact the young people for the endline survey via their mobile phone, we couldn't get the majority of the young people because they had either changed their SIM card or signed up for a different service. And so it was really, indicative of how frequently a SIM card turnover is among young people. Mozambique.
Some of those real world problems that you don't, you might not consider when you begin implementation of your project. Yes, those are the field reality and how it shapes the use of the mobile tool is a very critical piece of the program design, but also and anticipating those kinds of issues are very important, but also will affect your results. So, very good point. So we have, I think, about 5 more minutes to get through, 6 minutes to get through 2 questions. So I'm going to try to keep us on time. Our third question is really a 2-barrel question. The first part of it is, what tools are out there to help program implementers do evaluation? And the second part of that question, very closely related to it, is what benefits do you get with when you're using an mHealth tool that might make evaluation easier to do than if you didn't have the mHealth application for your program? So Marianne, let's start.
Yeah, great. So last year I attended a meeting where Hopkins had done a review of all the different, not all, but a lot of mHealth programs and the literature that is out there, either in the peer-reviewed literature or in gray literature, to see what the strength of the evidence was. And it was a very interesting presentation of the results, and that, even though programs may be documenting pilots, they're not documenting actual data, right? It's just more program description. And so what they've, based out of that, they also, sort of put together some standard indicators that programs could use to actually measure the effect of their mHealth program from a variety of angles. And so we can share that with you all and those tools. And I think, having a standard common set of indicators will allow different projects to be, compared
to each other,
which is really great. And then I think, what makes it really easy with an mHealth, not easy, but it's helpful with an mHealth program is that you have a wealth of data, almost too much data. You have data from, how much time it takes a user to complete a particular protocol, from actual clinical data or counseling data that you may be collecting through your application. And so while if you think about it from the design phase, building in the right indicators, you could do a research study, secondary data analysis, or collecting consent, and have a lot of data that you can use to actually even link to actual improvements and outcomes. So, and I guess the last piece is that with technology, even, for example, like the SMS program that I have talked about, you can trigger randomization automatically. And I think that is a really robust way to even make, having different interventions that can be inbuilt into the program immediately, and just kind of running a really low cost
research study. Excellent. John?
Yeah, just one idea to add, which is, I guess, and that you both touched on, but mHealth can be used to actually facilitate evaluating your clinical intervention, like Marianne mentioned, or you can actually be studying the impact of mHealth. And we've seen a lot of tools or projects that are trying to do one or the other, but making sure it's very clear that, when you switch from pencil to pen in your medical records paper charts, you didn't necessarily have to do a new study on that. And so switching to mobile health, there are a lot of interventions that you don't need to do a new study in order to determine is mHealth going to make this easier or better in some way. But there are other ones where mHealth is actually enabling entirely new processes where it makes a lot of sense to do a study, and these could be especially targeted messaging to consumers and health workers using SMS or IVR or some other platform.
Great, well, we have exactly 1 minute left, which we'll give you each 30 seconds for our final question, which is, what advice do you have for newly minted mHealth experts that are going to be going out into the field and developing and implementing mHealth applications for their programs?
I'll start. Well,
This is a lightning round.
This is a lightning round. Related to evidence and research, build in your evaluation study from the beginning, from day one. It must be integrated into the entire design of your mobile tool and the program. And I'll repeat it because I repeat it every time we have a class, which is that the technology is 10%, the design is 90%. One of the pieces of that 90% is the mHealth or the evaluation.
And I would say that even if you are a program implementer, you may not have the full budget that you need to conduct a very rigorous research study. So what I would suggest is doing a lot of the background research that already exists on a type of program that you were interested in starting, and knowing where you could contribute to the evidence base, and trying to be very creative to still conduct research despite small program budgets. I think there are ways to be creative and to still do research and not have to be a very expensive, large randomized control trial. You're still contributing to the evidence base.
Well, I want to thank both of you for coming over to the work bar today and visiting with all of you. And our time is over, but we hope you enjoyed our discussion about the state of the evidence on mHealth, and we'll look forward to seeing you in class in 10 days. So take care and be well.
Thank you, Wolfie.
Thank you.
Thank you guys.